Good evening and welcome to Global Resources for Men. I am your host, Alicia Buss, and tonight I have the great pleasure and privilege of introducing you to Greg McKittrick. He is the director of Penile Rehabilitation Protocol Program, and he has been a compounding pharmacist for 30 years. He's also created his own post-prostatectomy protocol, which is just amazing, and so many other things that he's done over the course of his life. Tonight, he's going to be talking to us about men's health and longevity, erectile dysfunction, and intimacy issues. Thank you so much for being with us here tonight, Greg.
Thank you. I appreciate the introduction.
You're very welcome. So this is kind of an interesting topic, right? I feel that a lot of men struggle to have this kind of vulnerable conversation. Can you tell us a little bit about what led you down this path?
Sure. And as you said, I've been a pharmacist for a long time, and I predate Viagra, if that tells you anything. So, treating treating erectile dysfunction and sexual dysfunction throughout the course of my practice. The interesting thing about what I do really stemmed from, working in compounding pharmacy. Compounding pharmacy, for folks who just are not familiar with it, it's not your corner drugstore. It's not going up to Walgreens or CVS. Compounding pharmacy is all about finding solutions. So when there are no products available that will adequately treat a condition, or a patient can't use commercially available products for a number of reasons, the route of administration, or they're allergic to fillers or dyes, or again, we just have to address things in a little bit different pathway. That's where compounding really shines, because we come into play by being able to put different therapies into different modes of delivery in different combinations. And for a lot of the patients that I've worked with, and that's again for both patients, male and female, for hormone replacement therapy, longevity, weight loss, and a lot of sexual dysfunction, it just works very well through compounding. And I was working and doing a lot of patient education, and part of what I did also, I did a lot of marketing, and I did a lot of in-services for physician groups. To be perfectly honest, because with what I do, a lot of the education has to be to the doctors. They're not necessarily familiar with everything that I'm working with all the time. And anytime you're in that environment, you tend to start kind of building up more of a following where the physicians are referring patients in, especially if they learn that you're doing a lot of patient education and training. And that was really my forte, and it just kind of organically developed that I was working with a lot of sexual dysfunction, which from the physician standpoint, you see a lot of that through the urology offices or functional med offices. They were referring patients in, and sometimes these were for your basic hormone consults where, for women, it's the bioidentical hormones for estrogen, progesterone, that sort of thing, testosterone also. And for men, predominantly, it was for testosterone therapy. So working with patients and developing therapies for them, and things that would work to fit their lifestyles. But, predominantly we saw a tremendous number of patients that were coming in for sexual dysfunction, whether that be kind of your generic ED, which I say that, and it's I really think it's a poor description when we say erectile dysfunction. Most people think that means, well, you just can't get it up.
Right.
But in reality, sexual dysfunction or erectile dysfunction for men, sexual dysfunction for women, it means that your performance is not adequate for your desire. And that can mean anything from premature ejaculation to delayed ejaculation to anorgasmia, meaning you're not able to climax, to strict, unable to maintain an erection that is adequate for penetration, for penetrative sex. So when you look at that scope of patients, we worked with a lot of different things, everything from hormone imbalance to weight to even supplements that really were beneficial for them. And then started to kind of layer these different approaches of therapy using some of the kind of the commercially available products that are out there, the tablets like the Viagras and Cialis and Levitra. But a lot of times the tablets just don't work well. So we would combine them and put them into dosage forms that were really better suited for patients, things that absorbed more rapidly, that bypassed the gut, because there were a lot of absorption issues. And then that again kind of developed into more training of patients and counseling on ED and more severe ED, more developed cases where patients had, say, graduated from using the medicines that are commercially available, like the Viagras and Cialises, into things like penile injections, which those are medications that using vasodilators allow men to maintain erections.
So for
And
anybody out there who doesn't know what a vasodilator is,
sure, and again, medications like alprostadil or prostaglandin, papaverin, phentolamine, which they literally create and cause the relaxation of the blood vessels, allowing for increased blood flow and the ability to maintain the erection. And those are used either as single entities or in combinations, depending on what the patient's needs are. So
yeah.
again, kind of through the course of that, I started to recognize a population of patients that was growing in terms of my practice, and a lot of these patients were guys who had suffered from prostate cancer. And for those who are not aware, there's an old saying that if you live long enough as a man, you will have prostate cancer. You may not die of prostate cancer. You may never even have it diagnosed, but it is just something that uh, over the course of a long lifetime will probably develop. And, the unfortunate ones are the ones who develop the symptoms and start having issues at earlier ages. And then the treatments for prostate cancer, although new treatments are coming out that are much less invasive and much less debilitating, a lot of the treatments that have been around for a long time, like open prostatectomy or robotic Da Vinci prostatectomies or radiation, they cause a lot of after effects. And, those can be not just life altering, but in some cases, really debilitating to the point where they cause men to be incontinent, or it means, they leak urine all the time, wearing diapers, depends, that sort of thing. And can cause such severe erectile dysfunction that not only do you lose the ability to have an erection, but the lack of use leads to what's called penile atrophy, where you actually lose the size. So the penis, the tissue actually shrinks up, and so do the blood vessels that feed it. So dealing with that population of patients, it's extremely traumatic. And you talk about having a one-on-one consultation with patients who are just devastated in terms of their lives and their relationships. You can
Sure.
imagine if you're in that state where not only do you have erectile dysfunction, but you're leaking urine and literally have no intimacy in your life. So that pushed me to develop the protocol, the treatment protocol, which was published back about 6 years ago and has been republished several times. But I use that. I work with patients and physician groups around the country. I work with the prostate cancer support networks around the country. I'm a speaker for Zero Cancer, which is the largest U.S. based prostate cancer support network. So again, just that's kind of been the evolution of what I've done. I still work with a lot of patients who have what I would consider the introductory levels or mild to moderate levels of sexual dysfunction. I still work with a lot of patients who are looking to kind of rebalance their hormone levels or optimize their hormone levels, so to speak. And then, these more severe cases. So it's a broad spectrum of patients.
Have you also been working with patients that have experienced paralysis or any other sorts of disabilities that may be affected it in such a way?
Yeah, actually, I did a lot of work with some regional military bases where they saw a high incident of spinal cord injuries in their patients. And when you're referred, and I've got a soft spot for vets, man. So when these guys would come in, that was a high priority for me. So in a lot of cases, they had zero sensitivity, let alone any erectile function or response. So a lot of it came down to what could we do to, number one, restore their function, which was typically their biggest complaint. If they can't participate. And, I'm going to step back for 1 second because this is not specifically to those guys, but a general statement about men. When men cannot perform sexually, this is a huge factor. Not only does it hit the ego, but general self-esteem. And for men who can't perform, our nature is to withdraw, because if we can't cross the line at the end of the race there, so to speak, and break the tape, we're not going to start the race at all, which leads to a complete breakdown in intimacy, a breakdown in touching and
Yeah.
in communicating. So it's extremely important in terms of not only the individual self-esteem, but the relationships that person's involved in. So that was a bit of a sidestep, but yeah, so these patients would be referred in, and we had the mechanisms and the ability to restore erectile function, like I mentioned, using things like the penile injections, which if you've got blood flow, they'll allow you to maintain an erection. Um, for these people, for these patients, that was the case, but they were left in the what's called anorgasmia, or inability to climax, because there was a lack of sensation. So
Right.
what do you do for patients that they can have an erection, they can perform, they can have intercourse, but are unable to climax? And here's the other side of that coin. When a man can get an erection but cannot climax, and that can be for a number of reasons. There can be, again, an injury, there could be a surgical reason, there could be other medications. Antidepressants are huge in terms of causing anorgasmia. So there's a lot of different reasons, but that impacts the partner as well, because again, switching over to the psychologist here, for the female partner in the group, or male partner, whatever the case is, they can kind of put the blame on themselves with that and think, okay, I'm not turning you on, you're not satisfied with me, you're no longer interested in me. So again, you have this it's this spiraling effect where you have an inability to function, which then feeds into the emotional and the psychological. So these things layer in such a way that you're never really treating just one thing. You're
Sure.
generally treating this myriad of issues. And again, getting back to these particular patients with the spinal cord injuries, and we were actually able to use other treatments in combination to restore their ability, and actually allow them to enjoy climax. So other
Amazing.
medications, there's things like even CBD products have a great effect in terms of restoring the what they call the bliss, or the enjoyment factor, and they're great for the inflammation that can accompany these kinds of injuries. So you can get some restoration of nervous function from that. Medicines like oxytocin, which is it's a hormone in the body, but um, they typically refer to it as the cuddle hormone. It's when oxytocin levels are high, your emotional connectivity is much higher. For both men and women, it improves orgasmic response and your level of satisfaction with the sexual experience. So using different things like that, and then dopamine agonists that, again, they work in the brain, but dopamine is this pleasure chemical in our system. And as we stimulate dopamine, we can increase libido, we can increase orgasmic function. In men, you can actually stimulate the what's called the erectile cascade, which initiates chemically in the CNS from the brainstem. So all these
The
different
essential
factors.
nervous system, for anybody that doesn't know what that is.
Yeah. So all of these things play together, and we can approach a lot of these issues from just these multifaceted therapeutic approaches, and it allows us to address patients in I call it more holistic way, where you're actually treating the whole person, emotional and physical, and again, even from the central nervous system.
I really appreciate you sharing all of that and going into depth. I'm curious from the standpoint of some people believing in the full body orgasm and energetically. What are your thoughts on that in combination here?
Well, here's a real interesting point. Um, for and this was something that really came to understand working with a lot of these prostate cancer patients. There's the physical climax or orgasm or ejaculation. Really, it's a small component of the orgasmic response in general. So when a patient has a prostate cancer, has a prostatectomy, the prostate gland really provides the majority of the fluid or the ejaculate. There is a very small amount that comes from the sperm ducts and from the testicles themselves, very, very small in comparison to the fluid that's produced in the prostate. Well, when you remove the prostate, it's kind of like, well, when you take away the fruit, there's no juice. So these patients actually have a what's called a dry orgasm at that point. But the real interesting thing about this is these patients will report that that experience can be much more dramatic than the ejaculation because the orgasm itself, it's nervous system, of course it's emotional and it's got the excitatory response, but it's also about these muscle contractions that involve well beyond just the penis and testicles. It's the core of the body.
Yeah.
So much, and this is really interesting, something that I've learned this again working with a lot of patients. There will be some patients where this post prostatectomy or dry orgasm is so intense, it can actually lead to almost like a migraine headache because it hits their
I've
system
met
so hard.
people like that before.
Yeah,
Yeah, it's
and
interesting.
yep, it is so intense. So yeah, absolutely. There's so much more to it, and I find that to be true both for men and women because obviously a lot of the therapies that I work with, prostate cancer, but clitoral atrophy or vaginal atrophy, hormone deprivation in terms of women where they suffer from painful intercourse or you know lack of lubrication, breakdown of vaginal tissue, and there's actually a condition, it's called clitoral atrophy, where typically it's from overgrowth of tissue where the clitoris is becomes completely hooded and you lose sensitivity. So a lot of the therapies that we do for both men and women really affect what's going on in the entire system. So, you know, when you look at it from a hormonal level, what hormones are responsible for sexual function? Well, everybody thinks it's testosterone for men only, but it's not. There's more to it than that. Actually, estrogen is a big factor in terms of sexual function for men. And then with women, I mentioned, the oxytocin, testosterone, obviously, but estrogen again in terms of maintaining the health of the tissue. So yeah, there's so much more to orgasmic response than, touchy feely and the end result. So yeah, I'm a firm believer.
Absolutely. And I really appreciate you bringing up the aspect of the muscular experience because you and I have talked previously about pelvic floor physical therapy and how sometimes like having overly tight muscles in our pelvic floor can actually decrease the function and increase pain both for men and for women. So like sometimes they tell us, especially for women, it's like, oh, do lots of Kegels. But if you do too many
Right.
Kegels, it's actually negative for you. So you want to talk a little bit about that and the team that you have to support them in that fashion?
Well, and again, more often with men, we see a lack of pelvic floor strength being the issue, and doing pelvic floor exercises can increase response, increase control also. So for men who have issues with premature ejaculation, when they strengthen their core muscles, when they strengthen the pelvic floor, a lot of times it gives them better overall control and response sexually. With women, certainly you have to find that kind of happy spot in between where you have good control, where you have good responsiveness, but again, you're not tense to the point where you're in a perpetual clench. There has to be the ability to relax and to enjoy what you're doing.
Yeah, absolutely. And I think a lot of people don't realize that it can be physically painful for men to have sex as well. Like we hear that as women, but we rarely have that conversation about men.
Yeah. And again, there's any number of reasons, but one of the things that I emphasize to patients and to anyone that I'm speaking to about these types of things, you know, most of what happens to us sexually is really between the ears, not really between the legs. And what ends up happening is we get, call it off kilter, or, we get in a funk in terms of sexual performance, whether that be erectile dysfunction or premature ejaculation or delayed ejaculation, whatever the case is. And then it hits home in the head, in the brain. And boy, once it takes root in between the ears, this is where, this becomes this real downward spiral, because once it is such a fixated aspect of your psyche that you can't enjoy what you're doing, that manifests in so many different ways.
Yeah.
So for women, we can see both from physical, from hormonal, but also from the psychological aspect, having painful intercourse or really unenjoyable intercourse. And for men, the ability to perform also can be completely impeded through just, again, what's going on between the ears.
Absolutely. I think that also includes from the standpoint of just daily stressors and people that are dealing with chronic pain systemically or in a particular area or having weakness or something that's compromised that you have to pay attention to, right? And some of the insecurity that can come from that. In honoring that we need to really listen to our bodies as well as those of our partners so that we can have that open communication line without increasing that insecurity that might be occurring that can then of course just compound the issue that's occurring, right?
Yeah. And from a very, I guess, transparent pathway of thinking of, how this sort of mentality works and psyche works. Now, I work with hundreds of weight loss clinics around the country. And, the thing that I try to really impress upon these providers, the practitioners, for them to kind of mention or at least incorporate into the therapy for the patients. As patients come in and they have body image issues, um, maybe also physical issues due to that, where they have the inability or they can't perform the way they would like to due to their status in terms of their physicality, their weight. As these patients start to see the benefits of course, the new miracle drugs, these Wegovy's and Ozempics and Mounjaros and all the GLP-1s that our compounding pharmacies are working with too. But you start to see this shift mentally and emotionally in patients. They start to like the way they look. They start to have better energy. They feel better. So, we look at these patients and, the kind of the natural organic next step from, oh, you're losing weight. How's the libido? How's your sexual function? How's your hormone balance? So you can really kind of marry these things up. But sometimes it takes that kick in the pants to where, they can look in the mirror and like what they see. And all of a sudden that starts to flip that switch. And it's the same thing for men and women. Guys are 100% the same way because, you know, for a man who's looking at his body and, hey, I don't look like I did when I was 25. All of a sudden, I've got this belly around me, and my chest is sagging, my arms aren't nice and toned anymore. I'm not feeling good about myself. So, it's not just the women that are affected by this, men are too, and that affects their psyche as well. So, sometimes it's looking at this whole picture. How can we improve the overall aspects of the patient, and what's going to benefit them the most in the long run?
Yeah, absolutely. It's interesting. My head just drifted for a moment thinking about how oftentimes we may think that ED is something that happens to men when they're older or men who have, had an injury or they're on depressants or whatnot. How young have you seen gentlemen come in that might be struggling with this just so that we can increase awareness and that conversation potentially with parents if need be, if it's happening at a younger age?
So, and here's a real interesting statistic for you. I'm in the process of writing a guidebook, a physician guidebook that's about men's health. And, one of the, I guess, early indicators has to do with studies that are being done now with hypogonadism, or typically known as low testosterone for men. Whereas, we never really saw that in men until they were in their 40s, 50s, 60s, and beyond. And we know that there's degradation in terms of hormone production once we start getting past those decades. The problem is, and this has to do with lifestyle, it has to do with latency, it has to do with diets, it has to do with a lot of things. We're now seeing low T in 17, 18-year-old men in their 20s, where they are actually showing up low, and this is therapeutic low based off of a lot of the national scales. Well, that same thing follows with sexual function. So as we're seeing these changes in body composition, this is affecting their glucose metabolism, insulin resistant hormone levels, body composition, muscle mass, even the bone structures. That feeds into circulatory function and blood pressure issues, adiposity, getting heavy. So we're seeing much younger patients presenting. And again, unfortunately, traditionally, what we have seen in the past, men in their 50s present. And, I hate this component of things because it's known in the medical community as the door handle conversation. And here's how this goes. John Smith shows up at the doctor's office because he's got a cough. So he's in there talking to the doctor, and they go through, listen to this. Oh yeah, you sound okay. Everything's okay. And looks like your physical's coming up and this and that. And literally, as the doctor's walking out of the room with his hand on the doorknob, Joe Smith says, by the way, there's one other thing. And it's almost this hesitancy, this embarrassment to even to the own physician have the conversation, but things aren't working the way they used to.
Yeah.
This is more so for younger men. If you can imagine how hard that is for a man who's in his 50s or 60s, talk about a man who's in his late 20s or 30s or early 40s. And all of a sudden, things just aren't standing up. They're not doing what
Yeah.
we want them to do anymore. And, I work a lot with supplements. I work a lot. One of the biggest contributors is nitric oxide, which it's a natural body vasodilator. It's natural gas in our system. The problem is that it production of nitric oxide by the age of 40 has dropped down to about 50%. And this
Interesting.
is for both men and women. So
Huh.
this is, if you actually showed a graph of natural nitric oxide production depleting, what you'd see is the opposite graph of vaso-occlusion, or thickening of blood vessels and arteries. Because as this nitric oxide goes away, our natural circulatory function is dropping off. Nitric oxide is also 100% necessary for sexual function. Well, here's the other
Interesting.
caveat to that. Nitric oxide is naturally produced, but we feed that through diet. So what is the problem with Americans in general? Our diets are terrible. So, nobody's eating natural greens and beets and, cucumbers and spinach. And, we wonder why we don't hold up as well as generations previous to
Yeah.
us. We talk about it, and I see patients that are in their 80s who, and their function is great. Their hormone levels are perfect. Their nitric oxide levels are off the chart. And, they come in and, because they had prostate cancer, they see me. But other than that, they were in great physical performance and shape. We're seeing more and more due to a lot of these factors, the lack of physical activity and diet, and really just, and we're becoming an electronic addicted
Yeah.
environment. So, from youth through our early 20s and 30s, we just spend so much time with our face in the screen that, the lack of activity and really busy lives. People are too busy to eat well. And, I hear that all the time. And it just my schedule is such that I can't really balance my diet. So, those factors play, and we see more and more at younger ages, men who really need to refocus. And a lot of times these are things that can be corrected. And we can make adjustments, we can change lifestyle, we can improve their overall metabolic functions, but that results in better sexual function, better physical function, better exercise tolerance. So yeah, it's a huge issue that's going on, and it's only getting worse.
Yes. When I was laughing at myself mostly for that. In regards to
Well,
the whole
no, and
not
then
eating well all the time. We all have our different things. In regards to conversation pieces with the men in regards to physical therapy, because oftentimes that's manual work, it's internal work, entering through the anus or around the base of the penis. For many men, that is uncomfortable.
right.
Metaphorically and physically. So, how do you help them get over that to be able to get the really support that they need?
I use a lot of very simple analogies when I'm working with my patients. And one thing that I'll frequently tell them is, if you fell off the curb and jacked your ankle around, and your ankle was swollen up like this and black and blue and couldn't walk on it, and you went to the emergency room and the doctor put an ace bandage on it and sent you home without doing an x-ray or an MRI or any physical manipulation, you'd feel cheated. You'd feel like, you absolutely did not get proper care. So why would you accept less therapy on an issue that is so much more dramatic and so much more really personal and important to your quality of life? So, I try very hard to kind of put things in perspective for men. We are emotional babies for a lot of things, and don't you dare talk about this in public. And it's a real shame. I think that in general, from what you're talking about, that is probably as intimate of a manipulation as most men are ever going to have. Even if they'd enjoy the hell out of it, they still aren't going to be real happy. They're going to be embarrassed. But for men to have these basic conversations, we're not a culture where a couple of guys are going to sit around over a couple of beers going, yeah, my dick's not working the way it should. Just don't know what's going on. Can't keep it up. Boy, it's just I feel really ashamed. Actually, it's shrinking. It's getting smaller all the time. No, hell no. Guys don't talk about that. That's
Yeah.
taboo. And a lot of the conversations that I have, and when I'm working with patients, they'll tell me right out that this is the most uncomfortable but oddly important conversation I've ever had, and some of the intimate details that they'll share. So again, when you're talking about physical manipulations and invasive manipulations, you have to really establish this kind of trust line to communicate, and it's really starts with, I mean, let's let go of ego. Let's get past this, because it's not helping anything. I've I tell everybody, I've got this wounded little child inside of me. So, I'm 58 years old, and if I don't work out 5 times a week, and if I can't, stand up in the gym next to the 20-year-olds, boy, I'm going to fall apart and break. But I joke about it because, that's how I was raised. I was raised that you don't complain, you don't talk, you don't share, you don't cry, any of that kind of stuff. So, to be able to get past that and get to a point where you can openly communicate and share. And, let's face it, we need to be vulnerable when we need help. And that's probably about as vulnerable as most men will ever get.
Absolutely. I really appreciate you sharing all of that. And it's not just vulnerable, it's courageous,
Yep,
right?
absolutely. That's the
And
big step.
yeah, I think sometimes with us reframing it and telling them that they're being courageous versus vulnerable, that perhaps that would help them, because just the natural buttons the value that's assigned to both of those words, it's really fascinating when we talk about mindset and how we frame things. Um, Also, for any of those guys out there listening, from the standpoint of physical therapy for pelvic floor, you can also have a tremendous amount of relief from low back pain and nerve pain that's going into your legs, which a lot of people simply aren't aware of. So while it is invasive and yeah, just generally awkward to talk about, you can have so much relief and a better quality of life if you're able to courageously step forward and receive that.
100% agree.
And in regards to partners or having new lovers, what advice would you give to those people as guidance in this sort of conversation? Both the people that want to frame it to those new people in their lives, or a person that's maybe been in their life for a while, and the opposite party.
So, and again, when we're dealing with a lot of the patients that I work with in terms of the sexual dysfunctions, those are those are really extreme cases. And I have seen both ends of the spectrum working with partners. Um, Actually, to the point where I now have a sexologist on my staff because when we're dealing with this, the necessity to break down the communication barriers and really restore intimacy at the granular level is extremely important. One of the things that we see a lot of with, I've just used the prostate cancer as an example, ED in general, we'll say. There is shame, there's guilt, there's blame, and a lot of this stems from lack of communication. So I, as the man, assume that because I can't get it up, I can't satisfy you. So obviously, you're going to be resentful of me and you are going to find somebody else because I can't perform and I've let you down. Now, as the woman, looking at it as, well, maybe it's my fault. I can't stimulate him. He's no longer excited by me. And, through that whole course, all of that really revolves around intercourse or penetrative sex. A lot of times when I'm working with patients, we're working towards the ability to have penetrative sex. In the meantime, guess what? There's a hell of a lot we can do in terms of touching and holding, and kissing, and licking and touching and fingering and toys and everything that we just forget about. I use a real simple conversation point with patients, especially when I'm talking with couples. Like, can you even try to remember back when you were 15 and you're on your first date, or you're 16? Let's say 16, because that's where you're driving. You're 16, you're on your first date, and the girl reaches over and holds your hand. Are you kidding me? Are you joking? Your heart's going through your chest, your mind's exploding, you're sweating profusely, and then think in terms of, okay, you got a good night kiss and a hug. Holy shit, that
Yeah.
was incredible. But if we can reframe that expectation and take it back to where, what, that touch and that spontaneity and being able to tell somebody, it's okay if we do this. It's okay if we cuddle tonight. It's okay if so long as you want me near you, it's okay. However, we get to that point, there's other things that we can do in terms of reaching climax. And again, that's both men and women, whether a guy can get an erection or not. So, there's other ways to get to the end of that race, but that's really not the important thing. The important thing is the ability to communicate and, share with your partner that, hey, I just want you with me. I want you to be near me. And again, this is an ego thing for guys where, boy, it's hard to if you can't, you're not going to sit there and pound away and be the man of the house, and it's hard to break that down and be able to say, yeah, I'm okay with us just being close. So again, I think that's a huge component. And working with partners, and again, we actually do intimacy counseling for partners with our sexologist. And you know there are so many tools, and you think in terms of getting homework where you're actually sent home and you're told you guys have to sit and just hold each other for 30 minutes. Or you got to get naked and hold each other for 30 minutes, but do nothing else. Or you need to tell exactly what your expectations are in terms of any sexual encounter. And what are you most afraid of? And
Yeah.
or some role playing where you have the man have to say what he thinks his partner is feeling or thinking, and the same thing for the woman. And then what you end up with is this, oh hell no, that's not what I'm thinking. That never would cross my mind. But
Yeah.
again, it's what gets stuck in our head. So yeah, the emotional and the ability to work through a lot of those intimacy issues, a lot of it is just straight out communication, but a lot of it is again just being willing to kind of put down those walls and shake the ego and be open and emotional.
Yeah. I could not possibly agree more. Yeah, I'm so grateful for the work that you do across the board for men and for women. I've dealt with pain with sex like basically my entire life to one degree or another, and have gone through many rounds of pelvic floor physical therapy. And so, and it can be a really difficult conversation for people. And how you talked about the men's side of what you guys are wanting to do, and for women, like we like many. I can't speak for all women because I don't know all of them, but many of us, like, we want to please our partner. Like we have our own performative anxiety and like our own desire to create that space and connection. And like I also deal with chronic pain. And so because I've had 2 low back surgeries. And so it's just like having to have those conversations of insecurity. Well, like I can do this, but I can't do that because you might literally break me.
Right.
And like this hurts or like whatever. And just being able to have those conversations are so incredibly important to be able to just guide people through. I tell people all the time, I'm just like, you leave the ego at the door when it comes to being a lover, whether it's somebody who's new or somebody that you've had as a lover your whole life as a partner, because any person's day can be different, right? No matter where you are on that spectrum. So you come to the bedroom and you're present with that
Right.
person, and you're just like, how are you? What do you need? What do you want? Like advocating for that and letting go of like, oh, this is going to sound silly, or they're going to be mad because I can't do this or do that. And when you're with somebody, wanting to be with somebody who actually gives a shit about you
Yeah.
enough to hold that space with you. Because if you're not with somebody who gives a shit about you, that's an entirely different conversation that you're going to need to have, you know?
And again, if someone won't respect your boundaries, and again, whether they be
Yeah,
physical limitations or maybe there's some trauma in the background, and certain
absolutely.
activities trigger that. So having that understanding and the respect of your partner to where you recognize whether again hey, I can't do particular positions. I'm sorry, but we can do this.
Right.
Or again, maybe it's has to do with being too aggressive or force, or not aggressive enough in some cases, whatever the case might be. But
Yeah,
it's
absolutely.
really about having that ability to express and to listen, and to not just listen but hear, and really
Thank
be
you so much
empathetic.
for like,
Yeah,
clarifying that for people who don't understand.
yeah, absolutely, absolutely. And again, like I said, this is something where working with patients for so long, um, and I think I've probably seen about as many different forms of dysfunction, and both for men and women. But you come to a point where there's so many commonalities that are kind of in that middle ground. And if you can get people to move to their center with that when they're moving together, I think you can achieve a lot.
Absolutely. Communication and grace and kindness go just so very far in the world, both in and outside of the bedroom.
And I
So,
know there's a lot of guys that are tuning in on this, so don't be put off by sensitivity and emotion, because you can still be the cowboy when you're walking in the streets and conducting your business, but you know hang up the 6 shooters and the cowboy boots when you walk into the bedroom.
absolutely. And that respect that we have as partners, oftentimes when you do show up in that authentic space, will get you a lot farther if you're real in any aspect, right?
I
Be
believe that.
yourself, the good, the bad, the ugly, and just do your best to be kind, right?
That's it.
Yeah,
And
it
enjoy.
allows us, yeah,
And be
and
in the
to
moment.
enjoy, because you can still be a leader by holding that space and leading and saying, this is the space that I'm in, which actually allows us to relax more and
Yep.
to be more in our feminine in that space. So it's kind of counterintuitive. You're like, but this makes me feel weak, but you actually are stronger and allows that more integrated dynamic.
Well, and I think that the rewards are going to be justifying any uh, call it insecurity that they feel initially, because once they actually kind of break through that and become mindful of their partner and what their partner needs, and the old saying, read the room, but
Yes.
really digging into. So yeah, and again, like I said, a lot of what I do has to do with the pathophysiology and the pharmacology, and I do everything possible to put the tools in play that are necessary. But at the same time, we have to absolutely focus on, this is not just a mechanical relationship. This is not just we're going to, create interaction. And I work with a lot of patients, and this is taking it, I guess, to the about as dramatic as you can. A lot of patients who have gone through prostatectomy down the road, they'll get what's called a penile implant.
Yeah.
Now, this is where they literally insert inflatable cylinders into the penis. You have a pump where you pump the bladder of saline in to create the erection. It can't get any more mechanical than this. You're literally mechanically pumping up the erection when you need it. But guess what? A lot of those guys still have the most incredible intimacy in their relationships, because especially the fact now they appreciate what they didn't have, and they appreciate the fact that this is like, this is my second chance at being able to be in this moment and be able to share this again. So you know you can look at it from both angles, I guess. In some, you think, well, all it is just you're physically giving them the ability to have sex. Yeah, but at the same time, you're restoring this very intimate connection for the couple.
Absolutely. Yeah. I actually know somebody firsthand who is paralyzed and he's had that. And it really, I knew him before and after as a friend, and it just made such a huge difference for him.
Yeah,
Um, yeah, just all the way around. And I was really happy for him in that next
yeah.
stage of his journey.
I do a lot of work with a company called Boston Scientific, and they're the largest manufacturer of those urological implants. So they've got some wonderful people that work with, and I work with them all over the country. So um, they do tremendous work.
Well, thank you so much for adding that to the conversation, Greg. It's been wonderful having you on here tonight. Is there anything you'd like to add before we wrap up?
Um, One thing that I would say is, for guys who, maybe they are a little hesitant to ask questions, or, they want to maintain a certain level of anonymity.
Mhm.
I have a website, and it is called Penile Rehab Protocol. That's the name of the website, but it was designed with a lot of these prostate cancer patients in mind, but it addresses issues that really stem into, you know, performance in general, generalized ED questions, sexual inadequacies, whether it's performance anxiety or anorgasmia or what have you. So, visiting a site like that, it can give you a lot of good insight, and it's good information. I have a lot of my collaborative partners, um, both from the side of like the Boston Scientific folks and Zero Cancer, and a lot of the urology clinics, companies like Gainswave that work with ED for men, the supplement companies. So I mean, there's a ton of good information that you can find on your own by visiting the site. And then
Nice.
it gives you the option, if you want to have this conversation, you can actually connect through, just basically requesting a consult. So you can go into kind of a deeper dive, but again, it's still not having to go into a doctor's office to ask these questions. So you can ask them from the privacy of a telephone call if you want to. So, I encourage guys to find, if it's not my site, a site that gives them the ability to find the answers. Um, yeah, I think I've put a lot into, a lot of history and experience has gone into developing what we've done. So I encourage folks to look at it as a resource, and that's really what it was designed for, and a resource so that guys would be able to find these answers, or even their partners if they're trying to help along that journey.
Fantastic. You are a wealth of information, and I know have a million contacts and ways that men can be helped by you and the different people you collaborate with around the world, even. I know even in Ireland, you have a contact over there that you're developing things with, which is exciting. So thank you so much for being here. It's been a true pleasure to connect and have you here tonight. And everyone out there watching, and thank you for your time and sticking with us. You can find more information about the work that we're doing at Global Resources for Men on Instagram. We have our Global Resources for Men private Facebook page. And please do stay tuned on the YouTube channel Global Resources for Men as we cover different overarching themes each month to support men as we bring in experts and coaches from all around the world. So until next time, everyone, we'll see you later.
Thanks, guys.